Hello, everyone, I'm David and we have here with us Dr. Stigma Breaker. We are here to have a conversation about mental health during pandemic that we hope you will find helpful. Doctor, as we are aware that the coronavirus is spreading very rapidly all across the world and that we are being informed about it everywhere. Be it television, radio or smartphones, everyone is aware of the dreadfulness of the disease. How exactly is this affecting the mental status of a person?
Well, the coronavirus is undoubtedly changing the way we live, and for many people it is changing the way we die. The virus is causing major interruptions to our lives, coupled with the threat of its spread in such a drastic manner is causing anxiety and stress and depression. There could be financial crisis due to the lockdown. The pandemic had led to a series of losses, from a sense of safety to our social connections, to our financial security.
Is there any way we can figure out that we are worrying too much?
Well, the stress during the pandemic can depend on your background, social support from friends and family, your financial situation, your health and emotional background, the community you live in, and many other factors. The changes that can happen because of the pandemic and the ways we try to contain the spread of the virus can affect anyone. People who may respond more strongly are people who are at higher risk for severe illness from the coronavirus. For example, children and older people and people of any age group with certain underlying conditions like diabetes and heart diseases. Children and teenagers and people who are taking care of their loved ones can get more affected. Frontline workers like healthcare providers and first responders and the workers who work in the food industry. People with pre-existing mental health conditions. People who use substances or have a substance use disorder as in addiction can get affected due to the shortage of supply and increase in the demand in situations like this. People who have lost their jobs or reduced their working hours or had major changes in their employment, people with major disabilities or development delay. People who are socially isolated from others, including people who live alone or in rural areas or frontier areas. People who are minorities. People who do not have access to the proper information. People who are homeless and people who live in the group settings. It could be either hostels or jobs and anything.
So doctor, please tell us, how can we cope with stress efficiently?
Take care of your friends and family, but it should always be balanced with care of yourself. Help others cope with their stress by providing social support. It can also make your community stronger. During the times of increased social distancing, people can still maintain social connections and care for their mental health. Phone calls and video chats can help you and your loved ones feel socially connected, less lonely or isolated. Know what to do when you are sick. Contact a health professional before you start your own treatment. Know how to and where to get the treatment and other support services, including counseling and therapy. Take care of your emotional health. It will help you think clearly and react to urgent needs to protect yourself and your family. Take breaks from watching news or reading or listening to news stories or social media, because hearing about pandemic repeatedly can be upsetting. Take care of your body. Eat healthy, exercise regularly and get plenty of sleep. Make time to unwind some activities you enjoy. Avoid excessive alcohol or substance use. Talk with people you trust about your concerns and how you are feeling. Maintain social distancing and connect with people through online means.
We will take a small break now, and after the break we will be right back with more useful information about the pandemic. So stay tuned. Welcome back everyone. We will continue with this discussion further. So doctor, Wearing a mask for the whole day could be troublesome for some people. We keep hearing from people that it is causing breathlessness or even difficulty in breathing. What is your suggestion, doctor?
Yes, it is definitely difficult to wear masks for such long periods of time, but we have no choice. This virus is spreading and we have to take some measures to prevent that from happening, and therefore we are forced to wear these. But however, there are some people who shouldn't wear a mask, for example anyone who has significant trouble in breathing or is unconscious, incapacitated or otherwise unable to remove the mask without assistance. Well, these are the people who shouldn't wear a mask, as there is always a risk for breathing difficulty and health hazard.
So as you have mentioned earlier, stress can lead to substance abuse and increased consumption of alcohol. So what can people who are currently facing these problems do to help themselves?
The first thing one can do is to contact a healthcare professional. Locate virtual treatment and recovery programs, take medication-assisted treatment for alcohol and opioid use disorders. Take the medication as prescribed and continue your therapy and seek help from telehealth services.
A lot of pet owners have abandoned their pets on the streets, and a lot of animal lovers are worried about their animals having a potential risk of getting infected. What would you like to comment on this?
Well, a small number of pets worldwide have been reported to get infected with virus, including cats and dogs. But please don't abandon your pets. I request you. Based on the limited information available to date, the risk of animals spreading virus to people is considered to be low. It appears that the virus can spread from people to animals in some situations. Therefore, treat pets like you would treat other family members. If a family member gets sick, isolate everyone including pets. Keep the cats indoor, don't let them roam freely outdoors. Walk dogs on leash and 6 feet apart from the people. Don't put face coverings on pets. They can harm them. Stay healthy around your pets. Contact a vet as soon as you notice anything alarming. Practice pet hygiene properly. Wash your hands properly after handling pets, their food supplies, waste and toys. Beware that children less than 5 years of age have weak immune systems, so they can get affected by the germs that your pets may carry.
We have witnessed many unfortunate cases of suicide during the period of pandemic. What are your thoughts on that?
Yes, it is very unfortunate. The thing is, different life experiences affect a person's risk for suicide. For example, the suicide risk is higher among people who have experienced violence, including child abuse, bullying, or sexual violence. Feelings of isolation, depression, anxiety and other emotional or financial stress, as I have mentioned earlier, are known to raise the risk for suicide. People may more likely to experience these feelings during a crisis like a pandemic. However, there are ways to protect against suicidal thoughts and behaviors. For example, support from friends, family, community, or feeling connected and having access to in-person or virtual counseling or therapy can help with suicidal thoughts and behavior, particularly during a crisis like this.
So doctor, we know that the children, teenagers and elderly are most likely to be affected with this in general. What can we do to help them? I mean particularly this group of people who are more vulnerable.
I'll talk about the children first. Children and teens, they react partly on what they see from the adults around them. When parents and caregivers deal with the coronavirus calmly and confidently, they can provide the best support for their children. Parents can be reassuring around children and teens if they are well prepared. But not all children and teens react in the same way. We can know that they are succumb to stress by noticing signs like excessive crying and irritation in younger children. Returning to behaviors that they have out from, like bedwetting. unhealthy eating and sleeping habits, acting out in teens, poor school performance or avoiding school, avoidance of activities that they have enjoyed in the past, unexplained headaches and body pains and substance abuse like alcohol and tobacco. Now the question is, what can we do to prevent this? You can answer the questions and share facts about the virus in a way that your child can understand. Reassuring your children and letting them know that it is okay to be upset can help to some extent. Limit the family exposure to media as they may misinterpret what they hear and can be frightened. Try to keep regular routines. If schools are closed, create a schedule for learning. Be a role model, take breaks, plenty of sleep, exercise, connect with friends and family. Spend time with your child in meaningful activities. And for elderly, same goes for elderly, be more careful about their health, see a healthcare professional if something seems concerning.
Does mental health play a crucial role in dealing with the pandemic?
Mental health is an important part of overall health and well-being. It affects how we think, feel, act, handle stress, relate to others, make choices during emergency. People with pre-existing mental health conditions or substance use disorders, like I said before, may particularly be vulnerable in an emergency. Conditions such as depression, anxiety, bipolar disorder, or schizophrenia affect a person's thinking, feeling, mood, behavior in a way that influences their ability to relate to others and function each day. These conditions may be situational or chronic. People with pre-existing mental health conditions should continue their treatment and be aware of new or worsening symptoms. Call your healthcare provider.
It is a very sensitive issue, but people are still confused about how to deal with the loss of a loved one during the pandemic and what is the right way to perform the funeral ceremonies.
Grieving loss of the loved ones during the pandemic, fear and anxiety can be overwhelming. It may be difficult for people to make decisions about how to safely grieve and honor their loved one. The guidance is for the families as they work with the funeral directors, community and religious leaders and others to plan and hold funeral services and visitations during the coronavirus pandemic. People who have died from coronavirus can be buried or cremated. It doesn't require you to change wishes of your deceased family member. In general, there is no delay in funeral services and visitations due to the pandemic. However, some changes to traditional practices are needed. In communities that have experienced large number of deaths, family members may need to discuss timing of services with funeral service providers. There is no risk associated with being in the same room at a funeral service or visitation with body of a deceased person who had a confirmed case of corona or a suspected case of coronavirus after the body has been prepared. Take precautions while holding a funeral. Invite less people and limit the traditional practices of offering things to others as a religious practice. Practice social distancing. Don't touch the body of the deceased if it hasn't been prepared. Safely revive the belongings of your loved ones using the gloves and good hand hygiene. Limit the rituals that includes touching the deceased body.
Before we end this conversation, I would like to ask you one last question, Dr. Stigma Breaker. We know that people have experienced rejection from the healthcare professionals and other providers and common people due to the lack of knowledge and because those people belong to certain minorities. So we know that somewhere the stigma still exists. There is verbal abuse or physical violence and people have experienced discrimination. So how can we prevent this, doctor?
Yes, stigma can affect emotional, mental and physical health of the stigmatized groups and the community they live in. So we can prevent that by maintaining the privacy and the confidentiality of those seeking healthcare and a part of any contact investigation. By correcting the negative language and by speaking against negative behavior and statements including social media. using media channels and news and social media to speak out against stereotyping groups of people who experience stigma because of the coronavirus. Thanking healthcare workers and frontliners and suggesting mental health and other social service providers who experienced stigma and discrimination.
This brings us to the end of the discussion. Thank you so much, Doctor, for giving us your valuable time.
Thank you so much for having me here.
That's it for today, guys. Thank you for your patience.